So moving from the pandemic into kind of this post-pandemic and new phase has been difficult. The challenges are great because we all changed a little bit during the pandemic, during COVID. But with the help from the state and the CDC and all the grants that we've been able to receive since then, that is definitely a blessing that has come from all of this, is the services that we are able to provide and the services we're able to increase due to this increased funding. We're a really small county. When I came on, there were 2 other full-time people and I was just part-time, and now I have 9 employees. So I think that in itself says a lot. We've added numerous services that we were not able to offer before. And this new building, which was built with ARPA funding, is an amazing location. You can't miss us. We were tucked away in a corner where it would be very difficult to find us before, to where now you can't miss us. So we are really grateful for the opportunity to be able to have this building and provide all these new services. Some of our services are not offered anywhere else in the county. Those are the services that I want to focus on and make sure that we can provide those as often as possible. Mental health services is a brand new service that we are offering. Being able to give, the kiddos shots that can't make it, they can't afford gas money to drive to the doctor, or they don't have the time, the parents can't take off work. We have extended our hours where we're open 1 Saturday a month from 8 to noon. Having this building and this 3 separate exam rooms are one of my very favorite things. We have an exam room that is completely dedicated to WIC. We have a negative pressure room, so if we have somebody that comes in that we suspect of some kind of potential airborne illness, we don't have to turn them away, which we had to at our previous building. We couldn't let them in the building. We shared offices with many other people, so we can send them into a room and try to get things figured out for them and not have to worry about infecting other people or anything spreading. And then our drive-through, many people ask about our drive-through. There are many services that we can provide through a drive-through, including a birth and death certificate. Moms can come load their WIC cars without having to get, all 3 or 4 of their children out and then buckled back in their seats when they're done. Having a mom be able to come through without having to get her brand new baby out of the car and just through the drive-through able to get that birth certificate has been a huge benefit. And also, we have a lot of people come in to get water test kits for their wells and different things. We have city workers that come routinely because they have to do those. They can come get their kits through the drive-through and drop them back off, which saves a couple of minutes in their day of not having to park and get out. So the drive-through window can be utilized for many things, including they can drive up, get a form for an immunization, drive into our portico, fill out their form. We will come out and administer their shot to them without them ever having to get out of their vehicle. Osage County and myself are really grateful for the funding that has come down through the federal level and through the state level. It has been a complete blessing to us. We wouldn't have a lot of what we have right now if it wasn't for that. We've increased our lab draws by over 100%. I mean, it is, that was a service that we rarely provided, and now people come in, we have 2, 3, 4 lab draws a week, which we might have had 4 or 5 a year. We've been able to add drug testing too, which has been, for the college specifically, really helpful. The support has been amazing. The majority of the community has been incredibly supportive and excited for us. We've had people come in and they look around and they say, I didn't know we had a health department. I didn't know Osage County had a health department. What do you guys do? And I'm like, well, sit down. I'll run through the list. I'll let you know. I have big plans too for sports physicals and well women's exams and things like that. Those are coming in the future, but just trying to settle in here and kind of get our feet grounded, and then we're gonna keep on moving.